I'm Dr. Bhalla and I'm a GP at Colliery Court Medical Group in Bolden, South Tyneside. I'd like to talk to you about the coronavirus vaccines. I know that some people have concerns that they need 2 injections and also over the speed at which the vaccines were created. Firstly, both vaccines need 2 injections because that way they increase the number of antibodies in your body to fight COVID-19. A higher amount of antibodies means longer protection, and both vaccines are showing very promising results, which is great news. Both the Pfizer-BioNTech and the Oxford-AstraZeneca vaccines have undergone clinical trials. The Pfizer trials included 44,000 people of different ages, race, ethnicity and gender. This is great because it gives us a broad population to work with. These tests were done in the USA, Germany, Brazil, Argentina and Turkey, a real global effort. 22,000 people received the Pfizer vaccines and the other half received a placebo. This allowed scientists to measure whether those that received the vaccine were better protected against COVID-19 compared to those who got nothing. Scientists measured the amount of antibodies and found high levels of antibodies after the first injection and even more by the second. Interestingly, it was found that you produce more antibodies from the vaccine than if you caught COVID. This too is great news. Phase 3 of the clinical trials found that the vaccine maintained its high antibody levels in patients with long-term conditions. The Oxford trials included 21,000 people of different ages, gender, ethnicity and race. These trials were done in the UK, Brazil and South Africa, which is great because you have a broad population to work with. After the first dose, it was found that people had a high amount of antibody production. Even up until the second dose, scientists found that the antibodies were still high. 11,000 people in phase 3 had over 70% protection against developing COVID symptoms. It is important to know that people may need a booster, and scientists are still conducting trials and monitoring mutations of COVID-19 to stay on top. This is reassuring. It is important that as many people as possible have the vaccine. Please continue to follow government guidelines, and if you have any concerns, speak to a medical professional or visit the NHS website. The vaccine is free of charge on the NHS. There is a rollout taking place and you will be contacted when it is your turn. Stay safe, South Tyneside, and thank you.